My name is Yelena Bodine, and in 2024, along with a group of 5 international collaborators, we published recommendations for disorders of consciousness common data elements for outcomes and endpoints. In treating patients with severe brain injury and disorders of consciousness, abbreviated DOC, a primary goal for clinicians is to predict outcome or the degree to which there will be recovery in domains including functional independence, physical and emotional health, participation, and quality of life. Outcome assessment is also a priority in DOC research, whether investigating the natural history of DOC recovery, developing prognostic models, or evaluating treatment efficacy. Typically, investigators select whichever outcome measure is best suited to their research question. But what happens when each study uses a different outcome measure? How can we compare results across studies, pool research together to provide stronger evidence for a finding, or convincingly translate our research findings into clinical practice? Common data elements, or CDEs, are intended to address this issue. CDEs are standardized questions or measures with specific response options that can be used to facilitate consistent data collection. CDEs have been established for different etiologies and settings, but until recently, CDEs for DOC did not exist. The Neurocritical Care Society, Curing Coma Campaign, set out to fill this gap by developing CDEs in multiple domains, including DOC outcomes and endpoints in both adults and children. How did we do this? First, we identified criteria that a measure must meet to be considered a DOC CDE outcome or endpoint. The first criterion is that measures had to include items that could be administered to, performed by, or completed on behalf of individuals with a DOC diagnosis of coma, vegetative state or unresponsive wakefulness syndrome, minimally conscious state, or confusional state. For example, a performance-based measure, such as the Coma Recovery Scale Revised, could be considered a DOC CDE because it is designed and validated for use in individuals with DOC, and it can establish a DOC diagnosis. The Glasgow Outcome Scale Extended could also be considered a DOC CDE because it has items that are relevant for individuals with DOC and can be completed by a surrogate on their behalf. On the other hand, comprehensive neuropsychological tests and subjective self-report measures of psychological health could not be considered DOC CDEs because they cannot be completed by or on behalf of individuals with DOC. The second criterion was that potential CDEs had to be relevant to a broad spectrum of DOC studies. DOC outcome can be assessed across many specific dimensions, such as intracranial pressure, days on a ventilator, medical complications, trunk control, to name a few. Rather than identify each potential outcome variable of interest, we focus on measures that address domains such as global function, disability, consciousness, cognitive function, general physical function, pain, and participation. Once we established these criteria, we identified candidate CDEs by following a systematic procedure that included reviewing and, if needed, modifying existing CDEs and nominating and systematically vetting new CDEs based on the literature. Our group voted on the inclusion of each proposed CDE, and at least 80% of voters had to agree to include a proposed measure for it to be selected as a DOC outcome or endpoint CDE. So what did we find? Among 23 existing adult CDEs that had the potential to be DOC outcome CDEs, 20 were selected during the voting process. We also identified 25 new CDEs as potential DOC outcomes and endpoints, and 14 of these were selected during the voting process. In total, we recommended 34 adult DOC CDE outcomes and endpoints. Among 19 existing pediatric CDEs that had the potential to become DOC outcome and endpoint CDEs, 18 were selected during the voting process, and we identified 5 new pediatric CDEs as potential DOC outcomes and endpoints, all of which were selected during the voting process. In total, we recommended 23 pediatric DOC outcome CDEs. Case report forms for all of these measures are freely available, and they can be found on the Open Access Inota website. These forms can be used to systematically collect data on the recommended outcome measures. The manuscript summarizing our results was published in 2024 in Volume 41 of Neurocritical Care. Although there are hundreds of outcome measures designed for persons with brain injury, these measures are often too coarse to detect subtle improvements or decline. They require cognitive abilities that have not yet been recovered in persons with DOC, or they cannot be obtained via a remote assessment. An ideal DOC outcome measure is objective, standardized, granular, multidimensional, feasible to administer, and captures a wide range of function, from coma to return to baseline. There's a clear need for development of DOC outcome measures that fulfill these criteria. Finally, the outcome measures we recommended were designed with minimal or no input from persons who have recovered from DOC or caregivers. The perspective of these key stakeholders with lived experience is critical for development of person-centered, relevant tools. So when you're designing your next DOC study, please refer to the recommended DOC outcome and endpoint CDEs so that we can continue to contribute and to optimize DOC research. Thank you and enjoy the rest of your World Coma Day.